Welcome to Cape Media News. I'm Gabrielle Rosson. I'm here today with Massachusetts State Senator for the Cape and Islands, State Senator Julian. Thank you for being here.
Of course, Gabrielle. Good to be with you.
How are you doing, first and foremost?
I'm all right. We have been working as a legislature remotely, actually, since the beginning of May. The beginning of March, not May. All the days are blended together. So my last day actually up in Boston was March 11th. And so we've been conducting our business at the legislature, really trying to adhere to social distancing, making sure that we're keeping our staff safe and our colleagues safe, but also doing everything we can to respond to this real unprecedented time. And it is an unprecedented time. And it's very, very difficult for so many of us. I feel really fortunate, actually, that I'm able to continue the work that we do, helping people, from home. Not everyone has that luxury. There's a lot of essential workers who are doing so much, both in the healthcare setting, in our hospitals, keeping our grocery stores and food supplies and pharmacies open, picking up the trash, doing everything that's needed to kind of keep our the basic functions of our society going.
Absolutely.
I'm on a lot of conference calls, can get a little stir crazy, but nothing that a good walk on the beach can't fix.
Absolutely. We're so fortunate to have so much natural beauty. Now, the COVID-19 pandemic has created a lot of unique challenges for Cape Cod, Martha's Vineyard, and Nantucket. Can you talk to us a little bit about how you and your colleagues have been dealing with this crisis, specifically on Cape Cod? What sort of services you guys have been trying to expand or provide?
Absolutely. So we really have sort of three roles here as legislators. We're appropriators. We come up with money, which we've done and will continue to do. We also pass legislation to make fixes, everything from prohibiting evictions, expanding unemployment insurance. So we have actually the most generous unemployment benefits in the nation, looking at issues around liability for first responders and healthcare workers, fixes to our municipalities, and then money's also been appropriated to respond. The second is problem solving. So, just figuring out whether it's from school closures to the needs of PPE in our nursing homes, to you sort of name it, working to solve those problems, and then communicating, making sure that there's accurate information that's out there. We're really fortunate on Cape Cod and the islands that we've got a real collaborative delegation. We've got marvelous resource in county government, in our municipalities who are used to providing mutual aid and working together. Cape Cod Healthcare has done an outstanding job really responding for this. Well, one of the most comforting calls that I have every week is with the CEO of Cape Cod Healthcare, Mike Loff, and his team. I'm really impressed with what they've been able to do. And then, we've also been dealing with a whole myriad of specific challenges. When you live on a peninsula, and particularly with the two islands that I represent, in Martha's Vineyard and Nantucket, there's a whole host of specific challenges and concerns. So a lot of time, there, I do think that we've been able to respond more effectively here on Cape Cod, because we've got such good collaboration and we're used to working as a region. Hopefully we're sort of peaked past the surge, although the recent developments with the Pleasant Bay nursing home is what we feared could happen, and I'm really worried about other facilities. These are some of the most vulnerable people in our communities being at risk.
Yeah, I actually want to talk to you a little bit about kind of our high-risk population here. Sean O'Brien, who's the Department Director of Barnstable County Department of Health and Environment, told us that, the numbers, of course, have gone up since Friday, and that we're really in a critical week. And with our specific demographic here on Cape Cod, I know you're probably well aware that a number of protests have popped up around the country, and also most recently here on Cape Cod. What are your feelings about that? And do you think people should continue to look to the governor before they start,
Yeah, I think most all reasonable people, are actually really complying with social distancing, with the essential service orders. And actually, I think that's actually reflected in our numbers, right? So if more people were doing what really just is a sort of a fringe group of folks, look, they've got a constitutional right, to do what they're doing. But if more people were actually doing that, we would see a very different number of cases on the ground. So I don't pay much attention to that at all. I really look at the epidemiology. I think the challenge for us is actually, so we're in a crucial period right now with the surge. We really need to make sure we bring all resources we can into bear for skilled nursing facilities, nursing homes, that are really, really, truly vulnerable. But also thinking about how do we navigate what is going to be an expected population influx that we'll see, particularly as the weather gets nicer and as some restrictions are eased. How do the people who, whether they're snowbirds, they've been sort of somewhere warm for the winter, they're second homeowners, or seasonal workers. I'm spending a lot of time thinking about how do we make sure those folks get the right information, to be very cautious about when they come and how they come and whether to come. And then if they do come, what are the steps they need to take? That would involve a 14-day quarantine, getting your supplies before you come here. I think we've got actually a model in how this worked relatively okay, at least from an epidemiological perspective. There was a noticeable sort of influx in population sort of around mid-March, when this was sort of just starting, or at least the stay-at-home orders were just starting. And we haven't seen, from an epidemiological perspective, sort of a pop, right, in cases because of that. So I'm really focused, really spending a lot of time thinking about how do we manage sort of wave 2, wave 3 of this, working with the hospitals, with the chambers of commerce and with our towns to put out some uniform guidance about how we keep people safe, but we navigate what's likely to come. So I think immediate term, it's surge, it's resources for nursing homes, it's keeping the cases relatively low. And then, medium term, next week, right, figuring out how do we begin to navigate that population influx that we expect to see.
Yeah, exactly. Now talk to me a little bit about small businesses. I'm hearing a lot of, friends that are small business owners here on Cape Cod saying that they were not able to access the funding that was made available through the CARES Act. Is there any talk, any whispers in the wind about maybe more legislation that would be passed for these small business owners, or any other help that may be available to them?
So it's really disappointing, and in some cases pretty shameful, about how the PPP program, the payroll production program, and others have been rolled out by this federal administration. It's disappointing, right, that large corporations are the ones that have been able to sort of get to the front of the line, and a lot of people haven't been helped. One, I think we have the people who have been able to access this are thanks to our local community banks who really stepped up here. There is actually, my understanding, and this is federal, so I'm not, not entirely my world, but there is a deal and an extension to sort of reauthorize PPE with an additional, I think it's almost $300 million. And, Democrats have been fighting really hard to have really important strings attached to that around those dollars flowing to community banks, minority-owned banks, places like here on the Cape Islands that we can actually benefit from that. That being said, PPP can be isn't a fit for all small businesses here, particularly those that have, a pretty limited payroll. The state launched actually just yesterday the pandemic unemployment assistance program, which was something actually we had expected wasn't going to happen until the end of April. And so that may be another avenue. But we really need to make sure that we're helping, so many of our employees and employers are do their work. The vast majority are employed in small businesses here. And so we need more of that federal help. I think the state is trying to figure out where how we can also play a role here. But the amount of money that we're talking about is so significant, and we're limited. We can't deficit spend in state government, and we're going to see a significant drop in our own revenue. So, this fiscal year that ends June 30th, we'll see between the 500 million to maybe almost $1 billion revenue gap. In FY21, the fiscal year that starts July 1st, anywhere between 4.6 and $6 billion revenue gap and a $43 billion budget. We're going to need the federal government to step up and help us out. Otherwise, we're not going to be able to do a whole myriad of things we need to do. This is the time where we need to be, getting resources to hospitals, propping up public health, first response. So hoping we get some help there, continue to get help there.
Absolutely. And I'll follow up with you, in the coming weeks and months. Hopefully you'll have some good news for us in that respect. Before I let you go, because I know you're very busy and hard at work, and we appreciate that, you had filed a number of bills in 2019 and 2020 relating to grandparents and children, drug
Yep.
misuse, housing, home care services, clean energy. What's the status of that work, and has it been impacted by COVID-19?
So, our focus right now has to be on responding to the pandemic, but we can't lose sight of other needs. And in fact, if you look at how the pandemic is playing out, it's truly the most vulnerable folks who are suffering the most, whether it's from incidents of disease or the real economic hardship that we have and we're going to see. Right? So for grandparents raising grandchildren, there's a real concern among grandparents raising grandchildren that if they became sick and God forbid were hospitalized, how would they take care of their grandchildren? Looking at the opioid epidemic, really can't lose sight of this other epidemic that we've had that we've been making so much progress on. So immediately, I'm trying. We're looking at all these sort of issues in the context of COVID-19, and there's a Senate working group. I'm a member of that. And then I think when we can, trying to get back to some of the business that we were doing more broadly, but it's going to be tough. The House passed a major transportation investment bill. The Senate, we passed a number of pieces of legislation, including a climate change, the most robust clean energy bill in the country around putting a price on carbon. We passed mental health legislation that I was very actively involved in and led that effort. And so that remains to be seen. But a number of these issues, particularly those in the health and welfare space, directly intersect with COVID-19. And so we're trying to keep our eye on that. I expect there'll be discussions about extending the legislative session. It typically ends July 31st. I expect we'll have to extend that. And just taking it like everyone else, taking it one day at a time. I do want to give one shout out for folks looking for information. Please rely on senatorcyr.com. That's senatorcyr.com. We've got a whole host of information out there. And please don't be shy about asking, reaching out for help, whether it's to my office or any of the other legislators here. That's what we're here to do. I'm really heartened by the real just overwhelming kind of response of Cape Codders, whether it's the Major Crisis Relief Fund, the Cape Cod makers that have made already 5,000 face shields. These are the sort of things that really show the strength and resilience of our community. But please don't be shy about reaching out for help. This is what we're here to do, and we'll try everything we can to navigate whatever situation you're in.
Wonderful, thank you. And can people still email you directly?
Of course, julian.cyr@masenate.gov. I get a few hundred emails a day, so if you don't hear back, just take your patience or ping again. But we're on top of it. It was a big challenge at first when initially, and I have an amazing team that works with me and really helps represent Cape Cod, Martha's Vineyard, and Nantucket.
Awesome. Well, thank you so much. Keep up the great work.
Thank you for having me. We'll talk soon.
Of course, we will. Thank you very much. Again, to our viewers, you've been watching Cape Media News. I'm Gabby Rosson, and thank you again, Julian Cyr.